So that patient was from Allahabad. She went to Allahabad hospital, refused. Went to Lucknow, refused because 50% mortality. She came to AIIMS. She was a relative of one very senior government official. I admitted her. She required surgery, and I told the attendant and all that risk is there. So they accepted the risk, gave consent also. But in the night at 10 o'clock, I put her for the list tomorrow. So tonight, I got a phone call from my consultant cardiologist colleague. He said, Dr. Sharma, why do you want to operate her? There is 50% risk of her death on table.
Right.
So there will be an inquiry. We will support you. But why do you want to take risk? What are you getting? I mean, I was in government hospital aim, so I was not getting any penny out of it. So I also got little worried. So I rang the relative that we shouldn't operate. He said, sir, we know. Where do you want us to sign? They signed that we know 50% risk of death for her. We are willing to take that risk. So I operated upon her next day, and luckily everything went on fine.
When I go further, sir, into the depths of after I've done my residency, what should be my aim? Should I set my foot in as a senior resident or immediately go for fellowship or specialization? What's your thought on this? That gets me to the next question here. Residency during your time and residency today. What is the difference? Government scenarios versus private working of a doctor in your field. You've been on both the sides, right? So what difference is there actually between government and private? Hi friends, this is Dr. Apoor Mehra, and it is a matter of great privilege here to record this particular session for which you have been waiting, I have been waiting, and I believe the entire team has been waiting. Uh, you have a person who is sitting at the top of a mountain where the world is deciding, right, to start the chase of the cliff. You know, uh, Human beings, they can just do anything possible in the world. As they classically say, a man rolling down of the mountain will stand up and shout to the mountain, I will come back and conquer you next year. As a mountain, you cannot grow, but as a human being, I can. What you say, you become. What you want to become, so start saying it. As Henry Ford beautifully pointed out, if you say you can and if you say you can't, in either case, you will be the truth. It is just not about climbing a mountain to reach to the summit. It's also the beautiful journey along. And when you reach the mountain, human beings are such. They don't reach there just to enjoy the view. They reach there to see the tip of the next mountain they wish to climb. A doctor has to learn every day. The day he doesn't, he dies. And with us is a phenomenal, phenomenal human being. There will be a fight between which is the best he is in. A wonderful academician, a beautiful artistic author, a great astute clinician, and more importantly, a wonderful speaker. Welcome to this talk, Professor Dr. J.B Sharma, sir.
Thank you, Dr. Poor Mehra. It is a real pleasure that to come here and to interact with you and with the dear students who have been students of e-concepts in obstetrics and gynecology. I'm so delighted that you started this e-concepts. I always had thought that there has been difficulty in reaching the medical students and postgraduate students. So that's why I wrote my textbook, because how many medical students or how many postgraduate students I can teach? Only those who are attending my classes. And I was in MMC before, worked in England also, and later on I moved to All India Institute of Medical Sciences. So though I could teach only my medical students or our postgraduate students. So there has been a lacuna, and that means if we can reach to almost all the students or postgraduate students of obs and gynae in the country, I used to wonder that is that possible? So I'm so delighted that Dr. Poor Mehra, you have started this e-concept in obstetrics and gynecology. You have started in all the subjects, but I'll restrict myself to obs and gynae. So we will reach all the postgraduate students of the country, and we can sort out the lacuna in knowledge. We can, clear their concepts, and that's why the name e-concepts in obs and gynae is there. So I'm rather thankful to you to do this noble thing, which of Mata Saraswati I always call, like, it's a very noble thing to teach our students. Whatever knowledge I could gain, I have gained. But I mean, if I don't teach it and I die without teaching, then what is the use of that? It will die with me. So that's why it's important that we pass on this knowledge to our youngsters, because now it is their time. And that is true for surgical skills also, that is true for any knowledge gained in our subject, and that is true for new research, new academics also. So I have tried to achieve excellence in my journey. Like I did my MBBS from Medical College Rohtak, now called PGIMS Rohtak, and then I did my MD in Obs and Gynae from there. It was little unusual to join Obs and Gynae as a male from Rohtak, because most of them were females. But when I was a child, I lost two of my aunts in childbirth trauma. So that, you know, left a deep impression on my mind. So I wanted to be a doctor, and I wanted to be a obstetrician and gynecologist. And then I realized that, women suffer a lot in childbirth. There is a second life for them. So I wanted to do something for that specialty. So that's why I joined Obs and Gynae, and I did my MD from Rohtak after doing MBBS. I was in AIIMS for 2 years after that, after doing senior residency from there. And then I got an opportunity to go to United Kingdom from 92 to 96, where I worked as a senior resident in Obs and Gynae at St. Bartholomew Hospital and Whipps Cross and Homerton Hospital, London, which are very world famous hospitals. And I had the opportunity of working with Professor Christopher Hudson, who has written a textbook, and even Sir Marcus Setchell, who is official gynecologist to Queen of England. In fact, he conducted delivery of Diana Spencer, and even during Kate Middleton's delivery, he was inside. So he was my consultant. So my idols have been very, very high. I mean, to interact with them, and it has been a pleasure. And I developed special interest in urogynecology while working in UK. I learnt birth corpus expansion, and I worked for a few months with Professor Linda Cardozo of King's College London, and did my training in urogynecology. So then I came back in 1996. Initially, I joined MEMC through UPSC as an assistant professor, and where I rose to become professor. But later I got an opportunity to join as faculty in AIIMS in 2003. So because of I was interested in academics, research, and other opportunities, so I realized that AIIMS was to have pinnacle of success. So I moved to AIIMS in 2003, and from there I rose to become professor and unit head, and then I superannuated in January 31st January 2025. So during my whole journey, I have worked in teaching hospitals. I taught medical students, postgraduate students, and started the Urogynae fellowship in AIIMS Delhi, first of its type, and we have already trained more than 10 postgraduate students in that. And I have been examiner for MBBS, DGO, DNB, MD, and also MRCOG. I did my MRCOG in London, and now I am a fellow of the Royal College. I am a fellow of the National Academy of Medical Sciences also, and of National Sciences also. And I have been examiner and coordinator of examiner for MRCOG. In fact, I go to London as MRCOG examiner. Very, very few Indians can have that. And we started the course, and just last month only, I was examiner and coordinator for MRCOG Part 3 in Delhi. So that is a matter of great, great pride that we are, and I have given opportunity to other fellows of the Royal College also from India to become like examiners for that. So teaching has always been my hobby, and I strongly believe that we must teach, and teaching has to be my passion. So I'm very happy, Dr. Puru, that you teach with passion. All your faculty, Dr. Jana Vora has been my student. I mean, she was always wonderful, and also she has now reached pinnacle of success. And all your Dr. Rena is wonderful. So it's a matter of great pride that you have got such wonderful faculty, and who teach with passion. I mean, teaching always has to be by passion, not by like forcefully. And then because it gives you so much inner pleasure, and whatever knowledge we have gained, it is the time that we pass on to the younger generation, and that remains true for surgical skills also, for academics, for research also. I was lucky to have like 2 research projects with Oxford University, and worth more than 2 crore rupees at that time. And I gave job to 15 people in India for 12 years. And both the 2 papers have been published in Lancet, which is the ultimate
Fantastic.
journal. I am a co-author for them. And I've done a lot of research projects with Indian Council of Medical Research, Department of Science and Technology, NBT, Government of India, Ministry of Health. So, and have more than 400 publications. And of course, you have mentioned about my textbook. So I always wanted to teach all the students in the country. That is only possible if we can write a textbook, or if we start at that time you hadn't started the e-concept, so otherwise that would have been much easier. So with those textbook, I mean, fortunately with your good wishes and God's grace, they are read all over the country now. They are one of the best sellers. So I feel happy, and students meet me from all over the country. They appreciate, and so I feel happy and satisfied that I have been able to reach to those medical students and postgraduate students, and they always say that we can understand everything written in the books. So there is further scope for improving those books. So, and I feel with collaboration with you, we can do better in those books also. So I'm very happy you have started these e-concepts, and I'll be happy to contribute as much as possible by giving lectures on my areas of my interest in obs and gynae, along with other esteemed faculty.
Wonderful, sir. So I think if you listen to what sir has spoken, he's been very humble in describing his journey, and he has been somebody who wants to contribute. And you learn while teaching, and you teach more if you learn more. My grandfather, my grandmother, my grandmother was a teacher herself. She always taught me this, that सरस्वती माँ, देवी सरस्वती माँ एक ऐसी देवी हैं, जितना आप नॉलेज को बांटेंगे वो देवी और बढ़ेंगी, तो वृद्धि होगी उसके अंदर. और फॉर द यंगर जनरेशन लक्ष्मी माँ का अपोजिट है, आप उसको जितना बचा के रखेंगे उतना वृद्धि होगी. सो मनी सेव्ड इज मनी अर्नड, एंड knowledge distributed is knowledge gained. So they have opposite rule in life, और दोनों की अपनी मानता है, राइट? इसीलिए अगर आप दिवाली पूजन करें तो उसमें देवी सरस्वती माँ इज ऑल्सो देयर एंड लक्ष्मी माँ इज ऑल्सो देयर. सो दिस इज समथिंग दैट यू शुड रिमेंबर. ऑल्सो इफ यू लिसन टू सर, his aim was always to reach to the postgraduates of gynae ops, so that he can leave this country with a better generation. The next generation is ready to take care of the patient. एक डॉक्टर अपने जीवन में लाखों लाखों पेशेंट्स का इलाज करता है. And look at the basic thing he said, we all remember why we started. And it is still fresh in his mind why as a male he chose to become a branch which is female dominated. Similarly here, sir, in orthopedics, now we have girls taking up this branch. Otherwise it was absolutely male dominated. So it's the opposite side on gynae ops. But fantastic. So, जिसने भी दुनिया से हटके कुछ किया है, टू बी नंबर वन यू हैव टू बी ऑड. सो आपको अगर अपनी ब्रांच से प्यार है और आपका एम क्लियर है, so nobody can stop you, and that is what I see here. And that also answers automatically this next thing, because he had a love, he had a reason. So he is doing fantastic as a male gynecologist. My next question, sir, you have been a clinician and a surgeon on one side, an academician. I understand both go hand in glove, but how did you create a balance between the two?
Yeah, it's very, very important. Quite often I meet doctors, they say if you are a good clinician, you can't be a good writer. In fact, some people criticize also those who are, good clinician, they don't have time to write. If you are a good teacher or a good writer, that means you are not seeing patients. So that's I explain to them that you see my research, all my publications are on clinical research, most of them. So that means I have seen that many patients. That's how I could generate that data. So that is absolutely wrong. We can definitely make a balance. You have to have passion for both teaching as well as academics, and as well as to some extent, administration and academics. So that is very important. That is always possible. So what I do, sir, I get lot of opportunities, offers to deliver talks in the country. But you believe it, I refuse 90 to 95%. So I prioritize. It's not I travel also, but I prioritize what is very, very important. Like, Royal College of Gynae meeting, I don't miss it. All India Congress of Gynae, I never miss it, because I am always a speaker and faculty in that. So like that's some very important. Similarly, if some very close friend calls me, or if it's the area of my interest, of my inclination, then I always attend it. But many which may not be of that priority, I mean, I have nothing against them. Nothing is small in this world. But because of the time constraint, you have to balance the family life also. I tend to attend my son also, my daughter also when they were young. So we can keep a balance, and but like I try to preserve my energy from useless things, which can be.
Got it.
And another thing that if something can be done by another person, I give it to them. Something which only I can do, I do that. So with that, even in the hospital, the patients also, like luckily being a professor, I always had postgraduate student fellows with me. So I would distribute patients to them, but in every patient I'll give my input. So that will fasten the process. So we can actually balance in such a way that we can see more patients also, we can do research also, academics also, and can do teaching also. Because if you are a professor in a medical college, then teaching has to be there. It has to be part and parcel of that.
Very
Similarly,
true.
academics and research have to be there. Apart, but of course, we are clinicians. So if you don't do clinical work or surgical work, then automatically will be upset, will be depressed. So we definitely, I have kept a balance in my life, and I wherever I could, preserve my energy and save. At that time, like I wrote my textbook, I used to get up at 5 o'clock in the morning. So from 5 to 8, I would write, and I would sit on the ground, like you know, who's available same way. So on the ground with all the books and with the people tree facing from our house. So that made a natural propensity to write.
Got it.
At that time, like the world was sleeping, so I and
5 a.m. to 8 a.m.
yes,
Fantastic.
5 in the morning, and then like in the vacation time, we have vacation, so 12 to 14 hours also I wrote. So
Fantastic.
it took me 5 years to write Ops book, 5 years to write Gynae book, and then at that time I was not on social media, so no mobile, and I was like this. So that you had to make some sacrifices at that time, and people would call me for, like I used to say that I have to attend to my son and I'm writing a textbook, so please forgive me. So I like that. So I try to save that much time, so that I advise my dear students also. So wherever you can avoid you can save time. I mean, you do those things which are of priority for you also, for your this thing, and other things which are not of your area of interest, maybe we can skip them. There is no point in taking 10 hobbies. You have one or two hobbies and take interest in that.
True.
Like I a little bit, I do go for swimming sometimes, some physical activity, but it's not that there's no point in. No, I see the students these days, some they're learning tabla also, some music also, some games, 4, 5, 6 times places they are going. So that is not fair. You choose one or two and then concentrate rest bit on your education and on your studies. So with that, I feel we can achieve lot more. So try to skip those areas which are not that much important, because time is limited, 24 hours only in 24 hours. So we have to balance it such a way so that we can judiciously use the time to the best possible opportunities. And everyone is different. So maybe my point of view may not be suitable for you. So you have to find your own way, what is most important and your area of interest, and how to divide that time. But there is no substitute for hard work. I mean, you can't, you may please your boss, that this thing, but no, ultimately it is the hard work. Hard work has to be done, and you have to burn midnight oil, as they say. There is no substitute for that. Those things cannot take you farther. I mean, sometimes like chamchagri, some those things, you may please the boss and all for few minutes only, but ultimately everyone see how good are you in your work. So, I mean, you have to work very hard. You have to be very sincere, honest in your work, and success will automatically come.
Beautiful. So there are so many things to take from what you just said. The bigger is the sacrifice, the bigger is the award. So be ready to sacrifice many of the things you love, but you realize there's a bigger gain in leaving it aside. Sometimes you have to step back to take a bigger jump. 5 years of writing each book, so 10 years of dedicated work. Leaving the bed early, 5 to 8, thinking about that your mind will be at peace in the most productive manner. Fortunately, sir, I operate the same hours. You 5 a.m. to 8 a.m. are my operative hours, and your mind is absolutely fresh,
That's the best time to. Yes.
And then there is no substitute for hard work. Keep things simple in life, simple things. If you are straight, you can go deep down. No crooked ways. Success is never supposed to come easy. If it was easy, everybody will get it. The 2% rule is very simple. The 2% who go beyond the norms, finally the rest 98% will follow them. So you should be that 2%. Learn to sacrifice. Learn to look in the mirror every day. You know what you're doing. Be truthful to yourself. Be honest. And such a beautiful thing to say. There is no shortcut. सेक्रीफाइस तो करना ही पड़ेगा. अगर आगे बढ़ना है तो सेक्रीफाइस तो करना ही पड़ेगा. Sir, that gets me to the next question here. Residency during your time and residency today. What is the difference?
Yeah, there is a lot of difference. Certain things, though, are common, but the major difference is that at our time there was like we used to give duties. You have done that, night duties, and there was no off next day. So quite often, sometimes we were working up to 18 hours a day also.
True.
Okay, and sometimes we would miss lunch, dinner, and all. I don't recommend that should be the norm. But definitely, like if I'm following a patient, suppose my patient is there, so at that time it was a routine that if she had not delivered during my tenure and it was an unusual case, so I'll stay in the next rotation of my colleague also, because I wanted to see, even if I was not delivering her or attending to that patient myself, but I would wanted to see. So even if I had gone for lunch or dinner, I would request my colleague that call me when she's taken for cesarean section or for forceps delivery. So that gave me so much input that I could follow it up. Otherwise, you see the next day, okay, what happened in the night at 4 o'clock? This surgery was done. So that is what I did at that time. At that time, I was very young. I was unmarried, so there was plenty of time. I stayed very close to our labor room and all. And then, so another thing happened. Even if I was not on duty, like I became good in forceps delivery. Maybe I was male, little bit, stronger also, and I had special inclination, so I could do. So if anyone could not apply forceps, they would call me. At that time, forceps were popular. So my colleague, surgery friends and medicine friends would say, "Okay, why do you go? You are not on duty, and if something goes wrong, unnecessarily will be blamed when you are not even on duty." I said, "No, I'll go. What? So I'm, alone, and by going there, so it improved my skills so much that I became one of the best forceps applicator at that time." And they would call me almost, unless the case which could not be delivered vaginally, accepting that, all other cases I could deliver. So that gave me so much. So you have to go a little bit extra, you have to do. If you say, oh, I'll do only 6 hours duty, 8 hours duty, as these days students are demanding, so okay, I don't disagree with that. We need to take care of our youngsters also. I am totally with them that too many duty hours also are not good for their physical health. But I feel that it should not be that bad that it affects our training schedule. This is happening in obs and gynae now because like breech deliveries are so less and they often happen in the night. So then, so there is no training of breech delivery. There is no training for forceps deliveries to them, especially rotational forceps. So with the result, when the resident is doing MD or SR ship, he or she has not conducted any forceps delivery, or at least difficult forceps delivery, or manual rotation or breech delivery. So then they will do 100% cesarean section for them. So gradually the skill of breech delivery, forceps delivery is disappearing. Right. So I feel sad with that. So that is what I want to highlight, that as a student, even if you are not on duty, if it's an interesting case, there is no harm in going at that time if possible. Not always possible, fine. So because then you will become so good in that work, and there will be continuity of care. You will know how the natural course happens in that particular disease.
Wonderful, sir. So basically, you want to say you had a different set of devotion to your branch.
Absolutely, sir.
And that is what it has resulted in, right? So you are going to study during residency, you're going to learn clinical skills, the surgical skills. What is one non-academic quality you feel that benefited you the most during your residency?
Yeah, like I was always I was fond of doing some physical activity all of us need to do. So it may be, it is different for someone may be good in cricket, someone may be good in football, volleyball, etc. I used to go for swimming and some other athletics, etc. So that I was not competing in this thing, but that kept me sort of healthy and happy. So everyone, all of us need to, so that stress is gone. So same way, in the night, my other friend from surgery and all. So after dinner, we would go for about half an hour for a walk. So that will, physical activity also. Plus, we would talk also. So whatever we did in the daytime, we will discuss. So if something bad also happened, we would discuss, and that would mellow down our tension. Wonderful. And all. So that is very good that you need to talk to each other. These days, I'm very sad that even in AIIMS and other places, so many students are becoming depressed. Many students are getting psychiatric treatment, PG students and all this work. So this is all because probably they are not talking to each other. So that is very, very crucial that students should talk to each other. If they have any difficulty, they can talk to their the faculty in charge and others, or but senior like residents or other residents, talking to them, come out with whatever problem you are having. So I'm sure there will be teachers will be happy to help you. Your senior PG or senior residents will be happy to share things if you are something is making you upset and all. Similarly, many times they don't get enough surgery, or they may not be adequately taught and all. So that is also there. So they should also talk about it.
Right.
And like in surgical scale, you are an orthopedician, surgeon yourself, myself. So most of our teaching is when we are operating. So that is the teaching. So we teach them, and I'll request my faculty colleagues also. So when they are operating, they should keep on speaking about what they are doing, the step they are taking, and the students should also ask questions. Sometimes, like I may be doing a step little different than written in the book. So students should. I feel very happy when they ask, sir, but in book it is written like that. So then I explain to them why I am taken this step. So that then the students will know both the steps. I mean, which is given in the traditional book. If you have done some deviation from that. So and that you can never forget. So it's important to see more patients, to see more operations, and study also. Some students have this habit of reading the textbook from first page to last page. That may be okay for some chapters, like whose cases you will not see. Like in our gynae book, there is a chapter of pre-operative care, post-operative care, fluid balance, and history. That you won't get the case, so that you should read once at least. But other chapter, it makes sense that suppose I'm tomorrow. I always used to see, sir, when I was a student, a PG student, I would see what is the class tomorrow. So a day
Right.
before, I would read that topic and go, and my teacher would ask me in my head. I always would answer it. So that made, and I could understand everything so well because I had read about that. Similarly, if there was a like say mastectomy tomorrow, so today I will read about it, and in the morning my madam would always ask that have you
Wonderful.
read, and someone hadn't read, they would send us out of the OT. So I mean, so whatever cases were there, so it makes sense that if I'm doing a case of myomectomy today, so the PG students should read that topic on that day, and after finishing the case also they should read that topic, and then you will never forget that. It's no point in, I mean, today I'm doing a case of myomectomy, but you are reading hysterectomy on that day, and on the day of hysterectomy already something. So it makes sense to read the topic whose case you have seen, and then
Fantastic.
you should they should come prepared with that topic. Then see the case. If any deviation from what they read in the book, they should ask the teacher. Teacher will be very happy. No teacher will mind question being asked. They will explain, and then you see the specimen also of that, cut section, how it looks like. Then compare it in the book, and in the evening again read it. I mean, so that then if you read it twice, one before surgery, and then during surgery you have seen the operation or assisted the operation, and you have read in the evening also, and read the post-operative notes also, and then
Fantastic.
follow the patient next day. So and you will never forget. If you have seen a case of hysterectomy, you have read it pre-operatively, post-operatively, operation notes, and then you have followed the patient for next 2 3 days when she was discharged, when was the dressing change, when was she started oral fluids, oral semi-solid diet, and like that, and when was the catheter removed. So then that is what is asked in exam actually, and that is how you can answer the question also. Problem is that sometimes we are not with practical. I remember asking questions about say patient of IUR, and the student was answering from high risk pregnancy, James high risk pregnancy. And but I asked them, are you following this? So he told me that okay, I'll do amniocentesis and look for LS ratio. Now this LS ratio has not been done for 20 years in India. So the person, so I asked the internal, it was an MD exam, I went somewhere. So I called the internal examiner that, are you doing LS ratio or Nile blue sulfate test on amniotic? They said, we haven't done for last 10 years. So that, then that means that student was not seeing patients at all.
Got
He
it.
was not seeing the practice in that hospital, and all he was doing was reading books. So that is also not fair. Reading is also important, but it should be with whatever is being done in your hospital. So suppose you are asked a question in exam, in practical, which you are not able to answer. So in that case, you can always say that is how it is being done in our hospital. And even if it is little different from what is written in the books, the internal examiner will support you. So this is very important. I always tell that please see what is being done in your hospital. Try to remember that. You have to read books, there is no doubt about that. But reading with the patient's care is the best method to learn, and then you will never forget.
Beautiful, sir. So my question has been, two questions have been answered, sir.
Okay, sir.
One was, what was the non-academic thing that helped you? And the second is academic. So you answered both.
Okay, thank you, sir.
When I look at the non-academic thing, I think you have mentioned two things which are extremely important. Number one, do something that keeps you fit. Whatever is your hobby, whether it's a walk, swimming, sports, whatever, follow that. Sir used athletics and swimming as one part of his routine. Second is walk and talk with your friends, your family, your parents if you get a chance. Because that's going to mellow you down, take it easy, whatever is becoming heavier for you. You know, we all are human beings. Gods don't do residencies. Human beings do. There are challenges. There will be tough days. As a surgeon, there will be tougher days. Speak it out. It eases it. Also, talk to your friend of how you feel. That will decrease the stress. But if you notice or yourself notice as a friend, you do have some psychiatric issue, get a consultation. There is no harm. But then, what Sir suggests is if you are talking to each other, with each other, the world becomes a better place. The residency becomes a smooth journey. It's a tough time, but this time is going to define next 60, 70 years of your life. Take it beautiful. Try to make it better. I know there's a lot of stress in the world today, but then I can tell you we are human beings. If we are with each other, there's always a benefit. The second thing, what he beautifully described is in many books it's written that an interaction between Sherlock Holmes and Watson. Watson asked Sherlock Holmes why you can see invisible things. And Sherlock Holmes said, it's not invisible, it's unnoticed. It's unnoticed, so I notice it. That is what is said about medical science, you know. In medical science, if you don't read a book, it's about you don't know how the sea looks like, how the boat looks like. But if you don't see the patient, it doesn't mean you have ever gone to the sea. So it is both important, hand in glove. Your eyes will only see what your mind knows. So develop a habit of, number one, first read and study what's going to happen tomorrow. You will be able to understand. And what you don't understand, sir, utilize it beautifully. Be open to ask. Your residency should be full of questions. अब नहीं तो कब पूछेंगे आप? पूछिए everything. There is no wrong question. There is no silly question. Every question comes out of an intellect of human beings. We are called as Buddhi Jeev, one of the greatest creation of Almighty. If it is coming to your brain and heart, be inquisitive. Stay foolish, but keep asking. Keep talking. What's the harm in it? You will go better tomorrow. You will learn. Your questions will become better with time. Your teachers are there. They're teachers, you know, they will always answer. A teacher's responsibility is to make a better student. A good teacher is a teacher who knows to improve his students, to work on him because they have crossed the stage. Nobody becomes 50 without crossing 25. So they are going to give and share their knowledge and improve and see that you become a better version. हर टीचर का यही सपना होता है कि उसका स्टूडेंट उसको बीट करे. हर टीचर का, trust me. Every teacher dreams this. There is no doubt about it. Right? Second thing he says is, once you have seen something, now you have just seen today something fresh, go and study it. Read about it. That will be permanently impregnated into your brain and then keep revising. Don't go after rare things. You don't see rare things. Read common things. Answer common things. And you will commonly do better. Look at the example sir gave. Something which is not followed clinically and you start mentioning it. It is just trying to expose that you haven't entered the sea and you're talking about all the strokes of swimming. And it's very, very important, you know, to stay connected. Stay connected. You're a social human being. You're not an isolated animal. As they classically wrote in the PSM book, a man who stays alone is either a beast or God. So you are a social human being. You are staying with friends and family. Talk to them. You are working in a hospital. Talk to your teachers. And beautifully, you know, sir is at that level he can sell that for his faculty members, teach us. We are hungry for knowledge. We trusted the college. We came for you as a student. Please teach us, our teachers. We want to learn from you. Because in a clinical science, in your surgical science, you actually require hand holding. Clinical feature may be seen again, but in a surgical case, a surgical finding after surgery is gone. So very aptly placed, sir. When I go further, sir, into the depths of after I've done my residency, what should be my aim? Should I set my foot in as a senior resident or immediately go for fellowship or specialization? What's your thought on this, sir?
That depends actually. That if the our person who had done MD in Obs and Gynae, DG or DNB, I mean, if they are happy to do obstetrics, they can do straight away. There is no point in that. And obstetrics is a very major chunk of our practice. And obstetrics is a never dying subject. It will always remain. In COVID times, I mean, all other specialties, there were no other operation, gynae operation, including
continued.
orthopedic operation. Obstetrics was the only thing which happened even at the peak of that. So obstetrics will always, delivery will always occur. So yeah, that is a good specialty, beautiful specialty. You create a new birth and they will always remember you. But even in that, you can do like these days fellowship in this thing. But and now gradually the concept of subspecialty is coming up. So those who are interested, then it makes sense. But still, I feel at least 1 year SRship everyone should do, if not 3 years, because it is during the SRship that they learn everything, the practical skills. During MD, actually now they have been, NMC has made it so difficult. So many things have to do. Almost 10 to 12 things have to be done. No, BCBR, GCPR, and lot of theses and one publication, one conference presentation, and all. So and then preparation. So most of the time is spent doing that and then study. So they don't have that much practical skills what should be there to start practice as a consultant. So at least preferably, I mean, if you are wanting to join Ops or General Ops Gynae, then you must do 3 years senior agency, even if you want to go in private practice. And during that time, you will realize that, my heart lies or beats for gynae onco. Then during that time, they join the senior residency, let them join, do for a year or so. And if they feel that, no, I want to do IVF, I want to do gynae onco, I want to do urogynae, so there are exams for that. So during that 1 year when they are doing senior residency, they should do the clinical work, and they, in the night they can prepare for the subspecialty. And if they get that subspecialty, then they can join that subspecialty, leaving SRship in between. That is okay, because now they are becoming, otherwise they will be very late in career. So, and they have learnt in 1 year, and when they are doing fellowship or DM or MCH, like in AIIMS we had this, and then they had to do some obstetric cover at that time also. So they will learn that also, plus their seniority will also continue, and then they can do. So those 50 to 60% people who want to do subspecialty, they should join that. Those who want to continue in obstetrics or general gynae, they should complete 3 years senior agency. Even if they want to go in practice, don't be in a hurry to start practice immediately after that.
True.
So that especially the surgical skills, I mean, medicine maybe they can do, but in surgical specialties, I mean, like you are an orthopedician, you know better than me, that, they have to learn it, and they have to do it initially under supervision, then independently under supervision, and so that then only they can become competent.
Not only the surgical skills, the decision making,
Absolutely.
the follow up of the patient sometimes teaches you more than the surgical skills. Talking to the patient, the care of the patient, the understanding. For you it's a routine, for them it's once in a lifetime thing. And I think yours is the only branch where you will always get sweets at the end. That's how it goes. Because a child gives birth to a mother is a classical saying.
Absolutely.
As a mother gives birth to a child. Sir, government scenarios versus private working of a doctor in your field. You've been on both the sides, right? So what difference is there actually between government and private?
Okay, I mean, to some extent, the practice grossly remains same. Obstetric deliveries will be same. Cesarean section will be same. So many things are common. But definitely, I mean, like in government setup, cesarean section rate is lower, and though in AIIMS it was higher because we used to cater to very difficult and complicated cases referred from different areas of the country. But generally, cesarean section rate is lower there in a government hospital and slightly higher in private hospital. And that also is not that people are doing unnecessary cesarean section, but because expectations are very high. These days, ladies are delaying like childbearing because of career too late. And then they are having only one child that also at 33, 34 years of age, and maybe pregnancy, maybe after IVF or difficult this thing. So they don't want to take any risk. So that also makes, and sometimes people are demanding cesarean on demand, So all those factors have to be taken into consideration. but otherwise surgery remains same, and maybe there will be little bit more, like only two things our specialty is different from other specialty. One is cesarean section, where alternative is there vaginal delivery, so there can be slightly more cesarean
Okay.
section rate in private practice. Similarly, unnecessary hysterectomy, you must have heard a lot. So many times, I mean, some hysterectomies, I'm not saying that all are unwanted. Some are probably done for benign condition where it can be avoided. So we have to give the choice to the patient, and that what Dr. Purv has been saying, that is very, very important. I mean, these days, communication skills, ethical practice, and talking to the patient is very, very important,
Very
and to
true.
avoid medical legal this thing also. I mean, touch wood, I'll just say that I have dealt with one of the most difficult cases in AIIMS, where mortality was so high. I had a patient, I remember, if you allow me, can I give an example?
Sure,
Yeah. So
100%.
this patient, she was 39-year-old, and she had an uterine tumor. It was benign, luckily. She had Eisenmenger syndrome. In Eisenmenger syndrome, I mean, any practice surgery you do, 50% mortality is there. So that patient was from Allahabad. She went to Allahabad hospital, refused. Went to Lucknow, refused because 50% mortality. She came to AIIMS. She was a relative of one very senior government official. I admitted her. She required surgery, and I put her. I told the attendant and all that risk is there, so they accepted the risk, gave consent also. But in the night at 10 o'clock, I put her for the list tomorrow. Like, so tonight, I got a phone call from my consultant cardiologist colleague. He said, Dr. Sharma, why do you want to operate her? There is 50% risk of her death on table.
Right.
So there will be an inquiry. We will support you, but why do you want to take risk? What are you getting? I mean, I was in government hospital AIIMS, so I was not getting any penny out of it. So I also got little worried. So I rang the relative that we shouldn't operate. He said, sir, we know. Where do you want us to sign? So they signed that we know there is a risk of 50% risk of death for her. We are willing to take that risk. So I operated upon her next day, and luckily everything went on fine. So same way, we used to do patient of percreta. So, placenta percreta, they require cesarean hysterectomy, and in percreta it is perforating the bladder. So bladder opening is a part of that. I mean, it has to be part of that. So I always arrange 6 to 7 units of blood, admit them. We'll do ballooning of the uterine artery, ballooning beforehand. Don't inflate them. Did a classical cesarean, and then opened the abdomen by vertical incision, did classical cesarean, handed over the baby to the pediatrician, and then we inflated the balloons, and then this thing. So it was going to the bladder, so it opened, and there was 2.5 to 3 liter blood loss, but ultimately baby was saved, mother was saved, and of course we left the catheter for 21 days. But I myself went out. I talked to, she was a relative of one of our senior financial advisor, very, I mean, good patient. I spoke to the husband myself. This is very important that as a surgeon, you should talk to the patient themselves, even if there is a complication. So in this case, bladder was opened, which we had told them before. So I told them that bladder got opened because it was going to that, and we did complete surgery. Patient is okay, baby is fine, but catheter will stay for 21 days. And this, so there was, so instead of complaint or medical legal issues, I got sweets next day.
Yeah, that's
And
what.
so,
In your branch, the maximum sweets,
yeah, no, so what I mean to say that if you be honest, even if there is a complication, similarly, sometimes the ureter get injured because in severe grade 4 endometriosis and all, but we sometimes you may have to do colostomy, this thing. So then I was the first one to go outside myself as a surgeon. Don't leave it to your residents and others. You talk to whosoever is doing the surgery, should talk to the patient attendant, explain to them that this complication has happened and this is what we have done. We call the surgeon, we call the urologist, we have sorted it out, but now catheter will stay. And usually 99%, I'm not 100%, 99% complaints can be avoided. 99% medical legal cases can be avoided by properly talking to them. Problem is that we don't explain to them, or we just don't write it properly and educate. You have to write everything in notes so that medical legally, even if there is a case, then we can defend ourselves. So, but I feel that 99% times we can avoid medical legal complications, unhappiness of the patients, and then, accordingly. So this is very much that talking to the patient, communication skills, and be honest about what has happened is very, very important. And then you can enjoy. Patients will respect you also, will thank you also for that. Thank you.
There are so many things to learn from this, sir. You were prepared for the surgeries. The blood was arranged. You had an idea or a foresight that this might happen. You had informed the attendants. You were the one to walk out and tell them that this is managed and take the responsibility, take the onus. If you listen to one of the beautiful interviews by our great ex-president Abdul Kalam ji, he said when he was in the first space mission, they failed, and when they failed, their leader went out and announced to the media that we failed and we'll come back next year. And next year, when the event was successful, right, he told his team, now you can go and announce to the media. A leader is not the one who is there only to take the garlands or the sweets. A leader is the one who's there to take the responsibility and then get the sweets.
Absolutely.
And why do you remember these cases, sir? Because you have a very big message for all the residents and everybody who's a clinician. If you want to have a good family, communicate everything with your family. The communication is the key for good harmony at home. Communication is the key for good harmony in the team. Plan tomorrow the OT. Talk to them with open heart. This case you will do, this case I will do, because everybody is there to serve the community and patients. And then communication most important with the patients. And then it has to be written down. A consent has to be mentioned. Till the time you cannot mention, till the time you do not do, you are digging your own problems, you're digging your own grave. So don't do that. Open, be honest. What will happen? Maximum to maximum, a patient will not get it operated, it's okay. You will have a great long surgical career of 50 years. You will get similar patients again and again. But what you will not get is another chance, right, in that patient if you're not correct with yourself. Because at the end of the day, you have to look in your own eyes that you did right, more than what the eyes see you. Sir, is this correct?
Absolutely.
The teacher that had the biggest impact on you, sir, apart from your parents. One teacher you were like, or more than one, you feel that they actually made you what you are today. You are extremely humble, very clear in what you're speaking. And who had the biggest influence on your life?
I recall from very childhood, I was in 5th class. So my own teacher in my village, Shekhar Gupta ji, he was our general teacher, would teach maths also. So on that, in one of the exam, I got 95 out of 100 in maths. I was the topper. Other second colleague got 70% marks, and I was beaten. And then he didn't say anything to others. So one of the persons carpenter was working in our school. So he told my father that your son must have failed. He was being beaten by the teacher. And then, so the teacher, he said that I have, expectation from you, not from others. How could you lose 5 marks? So after that, I always, we used to have choices in those days. Like out of 12 questions, we had to answer 10. So then I started doing all 12 questions. I would get 120 out of 100. I mean, you can't get more than that. So, but that, he said, no, you can't afford to lose even 1 mark in maths.
True.
So with that, I mean, and then in 10th class also, we had Rajaram Gupta ji teacher. At that time, we didn't take any tuitions. They were not like, these tuitions were not that popular, but they taught us, and, they left a reliable impression on me. And then in medical college also, we had wonderful teacher, Dr. Professor S.P. Gupta and, Dr. Keswani in surgery, and Dr. Mani in orthopedics, very brilliant teacher. Dr. Chadda in orthopedics we had. So Dr. A.S. Saini in our biochemistry. So they were wonderful teachers. My own teacher was Dr. Nirmal Gulati, under whom I did my MD in Obs Gynae. So madam was considered me like her son, and so always supported me, taught me. So even when I wrote the book, I went to her house specially to Rohtak. We reached at 10 o'clock. Somehow my car got, some punctured on the way. So by the time we reached, it was 10:30 in the night. But madam was waiting, but her servant had gone. She said, "Who will make tea for you? You are so late." I said, "Man, I don't want tea. I just came to you." So I touched her feet. I gave the book to her.
True.
And there were tears in her eyes. She said, "What I couldn't do, you have done." I mean, so I personally went. I said, "Madam, no, whatever I have become is because of you. And this book is dedicated to you." So I wrote her book in the acknowledgement and especially. So, the teacher's role is there. So I always remember those teachers. And I also tried to be a good teacher to many students. My students are all over the world now. Some are in US, UK, and in AIIMS students. So they keep remembering whenever, many students, I mean, some students have become these days little bit more practical and all. It's okay. But from our side, I mean, we will remain good teacher to them, and they will remain good student to them if they are doing very well anywhere. So, I feel happy for them. And I can quote my students also. Aditya Daya was our topper from AIIMS. He was my student. I was his examiner. I have never given such high marks to anyone. Then Zainab was my student. I gave her highest, I gave her 10 out of 10 in one this thing. And I told her that I wish I could ask you more questions. So Zainab said, sir, ask more questions. I said, there is nothing left now. You have answered everything. So, I mean, such students similarly, so this Aditya Daya now, he's an IAS officer in Haryana, commissioner now. And then another girl, Shaina Agarwal, she did, I want to tell that to everyone, she was in 8th semester, sir. So she came to me and we did she wanted to do a research project. So we did, and that paper is published in Archives in Gynaecology. So a medical student getting a paper in PubMed Index International Journal.
Beautiful.
From Switzerland and Germany. So she has, then later she chose to, she appeared in IAS exam. She topped in, she was first ranker, Shaina Agarwal, you can check. And now she's a commissioner in Punjab.
Fantastic.
So they have been our students who have been fond of studying, got good marks, and but they were still so much, still they meet me, they touch my feet. Like so we
so
have
true,
wonderful students also.
When I was talking to Aarti, Dr. Aarti Chatkara,
Yes,
who
yes, she has been
requested you
wonderful.
to come to conceptual gynae-ops, you know, she had a very fond memory कि सर अगर आएंगे तो बहुत अच्छा होगा. So Aarti, you know, she was the one to,
Yes.
and
Oh,
with
yes,
Dr. Raina to request you.
Aarti has been our senior resident, brilliant senior resident, and very fond of teaching and reading. Very good. So
And you know, sir, the next question which I have is very, very simple for everybody who's serving this country. You have been into government for majority of your career till now. Why staying in India rather than going abroad? You went from 92 to 96.
absolutely.
Why our motherland? Why not somewhere else?
Okay, yeah. So there is a good story about that. From 92 to 96, I was in UK. I did my MRCG. In fact, I passed USMLE also. So at that time, I was getting offer in Canada, Australia, Singapore. Could go to US also, and of course, I could stay in UK because had complete registration with General Medical Council and had done MRCG. But my wife was more homesick, and I also felt. So I got this job opportunities in India. And at that time, we had come to India. We were in two mind. I had got a job of assistant professor through UPSC. Plus, I was getting offer in UK. So we were little bit homesick also. But then we were going. Suddenly, we saw one car in front of our car. So we were in plus minus. And suddenly we realized it was Mother Teresa. So we chased her car, followed her, and then we reached there. So we met Mother Teresa, and then we touched her feet. So she blessed us, and she gave some silver, this thing, locket to my wife also. So then we asked Mother that, we are in a dilemma. We had the opportunity to settle in UK or USA plus in India. She said, come to India. India needs you. And then we just thought that maybe God is asking us to come back to India through her. So we decided.
Fantastic.
And another thing happened in UK. There was this one lecture of some Sai Baba's devotee. So we were in two mind again. At the end of the lecture, we asked him, what should we do? I mean, should we go back to India? Should we stay here? So he said, Dr. Sharma, if your mother is poor, if your mother is ugly, will you leave her for someone in UK? So I thought the answer was given. So then we decided. So we thought that as if God was asking us to come back to India. So I have no repentance. I could have my all colleagues, some of them stayed there, they are consultant. But I came, then worked in AIIMS. But my working there did not go waste. I had affiliation with the Royal College. I missed the examiner even now. Then I had affiliation with the Oxford University. We did two projects for 12 years. Every year I used to go to Oxford, Nottingham, London, Liverpool, etc. And two projects, two publications in Lancet. So that was like, it didn't go away. So I keep going even now, almost every year or alternate year I go to UK. I got affiliation with the college and Oxford University. So, but I stayed in my own country. In fact, I got 2 crore rupees transferred from Oxford University to India. I gave job to 12 people for 15 years.
Fantastic.
I did reverse brain drain. So what I feel that India needs us more, and now India is progressing very well.
Beautiful.
And those countries have reached a plateau. So and whatever, and when I was in UK, actually I used to get some dreams in the morning as if I was in a tunnel going. So I thought as if my soul was being encased. No, I had this feeling. Though, I mean, there are wonderful things of those countries also. It's a beautiful country, very neat and clean, methodical, and if things have to be done, they know, very little corruption. So there are many positive things also, but it is never your country. So I have no repentance. I have, I'm very fond of England. London is my favorite city. I keep going there. But I feel stay in your own country. You go there for tourism and have affiliation with them in, for research or academics or some projects, but better to stay in your own country, serve your own people. They need us more.
Very true, sir. That is so aptly put. And last few questions before we call it a day, sir.
Thank you.
Your favorite place in the world?
My favorite place, of course, is India and now Delhi, because we have been here, and whatever it is, Delhi may have its own problems of little bit more congestion and all. But let me tell you, I used to, when I was in London, that's the most beautiful city theoretically. I always crave to stay there. But I would dream of as if I was encaged. I was in a tunnel. But ever since I've been in Delhi, I never dreamt that. I feel as if I'm in open air and all. So we may have a little bit more congested, but like Delhi is a beautiful city to stay, to settle. We have wonderful people. We can go to anybody's house anytime, friends, so many friends. So I never have the opportunity to become depressed or upset that way. It may be a great country, those countries, but still you have emotional vacuum and all. I'm very happy to be in India, and it's a wonderful life. I have now given jobs to 3 or 4 people working with me and all. So I'm giving sort of taking care of 3 families indirectly.
Fantastic.
By giving them job. No.
True.
So I feel that if we can earn a little bit more money, give jobs to more people, so that should be our motto, so that we can take care of people, and like we promote our own country. India is doing very well now. We are progressing. Roads are becoming very good. Everything. Hospitals are becoming better. Private sector is coming in a big way. Teaching is becoming
It is.
epitome for teaching. So that is very good. So I feel that we should now try to settle in India. India offers good opportunities, and sky is the limit. I mean, in both government setup, private sector also, money also comes. So I feel, but don't run after money. Money, don't chase money. Money and name, fame will come automatically. We shouldn't be mad about it. I mean, we do our good work, है ना. I just quote भगवान रामकृष्ण परमहंस. उनसे किसी ने पूछा, वो कह रहे अपने अंदर शहद पैदा करो, मधुमक्खियाँ अपने आप आएंगी. So I mean, you be good in work, automatically patients will come, money will come, name and fame will come. But don't be mad for that. So we should do good work, and our conscience is clear. And apart from being a good doctor, be a good human being. That's what I tell my students.
Sir, as we go down, you have authored beautiful books.
Okay.
Please name your books so that people listening to this can get their hands on your books. I can tell you each of his books is a beauty. And if you are trying to understand gynae and obs, they are the gold standard. So they are something that every OBG resident should have it on their table. It is not for the shelf, it is for the table. Read something from it every day, and you will realize why it took him 5 years to write each one of them. Sir, can you please name the books so
Yes,
that
please.
our audience can get their hands on them? Sir?
Thank you, Dr. Poor, for your nice and kind words for my books. Yeah, my first book was Textbook of Obstetrics, and it is published by Arya Publications from Delhi. And it is available on Flipkart, Amazon, online also. But they are hard books, they are not soft copies, because some issues about hard soft copies. And you can they are available at almost all the bookshops throughout the country. Or you can tell your local bookseller, they can ask for those books. And my textbook of obstetrics is about 880 pages. Same gynae is also about 800 pages. So you can think that just obs and gynae total will be 1600. Why I have written so? But जैसे होता ना कि मेरे से घटिया लिखा ही नहीं जाता सर. So, and I feel that you have rightly started your project as conceptual, like of and gynae. So same way my book provide concepts for everything, and I haven't written anything which I have not understood myself.
True.
Sometimes as an author, sir, we make this mistake. Suppose I am writing a topic and I haven't understood it well. So these authors have the tendency to pass it on like that. But if you are vague about something you have written, if you have not understood, how will the students will understand? So I remember one of my chapter, it took me 1 month. I was not understanding something. Then I read more than 10 books. I had more than 10 papers got. I spoke to someone in London and to someone in New York. Until my concept was cleared about it, then only I wrote about it. So that has to be, there is no shortcut, this thing. And it took me 5 years to write. I am the sole author full book. These days, people, I mean, with all apologies, I don't want to hurt anyone's feelings, but people, they correct chapters from 30 authors,
True.
write a book in 2 months, 3 months, but those books don't see the light of the day. Because in that book only, there is so much heterogeneity, and there may be opposite things in the same book. I have seen it. So, but many times the people are writing books to become president of a society. Their target is different. My target was very clear. It was not for money. It was not for name or fame. It was very honest and sincere that I want to pass on my knowledge, what I have learned with great difficulty, to pass on to my juniors, to my students. When I did my MD, I used to read Williams Obstetrics. At that time, there was only one book, Dawn Obs Gynae, but those books were very small. I have highest regard for Dr. Dawn. Datta had come much later. And so I thought that, and Williams was very difficult to understand. I read it once, twice, thrice. It would take fourth or fifth time that you would understand it. But then one thing I want to tell the students, as PG student, how I became better in teaching. I used to teach my undergraduates, sir.
Got it.
So that is the best way. And my other senior PGs, SR, if it was their class, they would also give it to me. JB, it's my class, my exam is coming. Can you take my class? I said, okay, madam. They were making a fool of me. But with that, I read in the night. I was unmarried. In the night till 12 o'clock, 1 o'clock, I would read from Williams Obstetrics once, twice, thrice. So what can happen? Maximum the student can ask a question which I am not able to answer. So what? I mean, as a PG student, even if I am not able to answer a question, I will look for its answer. True. So if someone asks me a question which I can't answer, that is the best method to learn. So I asked my head of the department or professor to get the answer. And there is no shame in saying, if a medical student is asking me undergraduate student question which I am not able to answer at that time, there is no shame in that. Be honest. I said, I don't know about it, but I'll find out and I'll tell you tomorrow. So there is no shame in that. I was only a PG student. And then, but I got the answer, and that made my knowledge also better. So that is it. So then I had this sense that there should be a book. I mean, I was from Haryana, so our English was not that great, you know. And but then I said there should be a book which should have everything what Williams has, okay, but it should be readable and understandable for Indians. So that was my target, sir. So at that time I just thought, can that be possible? And then that's what I did. I took 5 years, spent really lot of time on the book, but I made each chapter, first fully read it from 10 sources, made it simplified in such a way that everyone could understand it. That even the person who is not that very, very intelligent, I have written the textbook not for toppers, but for the mediocre students. That Beautiful. Should be the target of the book. And touch wood, I get feedback from the student that they can understand the book. Font of the book is also bigger. So, I mean, so I get feedback that even those very small, like letters you write, they are not able to read it well. So, and then I've given about 800 pictures, flow charts, diagrams, and actual clinical photographs and my own operations. So that also has made it this thing. And I have given practical experience also, tried to make it very simple, tried to make it, practical also. Like actual, suppose you read a case of cesarean section chapter, so all the steps of cesarean section depicted diagrammatically also and actual photographs also. Both are there. Beautiful. So certain things you can pick up better from clinical photographs, some better from diagrammatic photograph. And post-operative care, first day, second day, third day. So it is very practical also. And it is very understandable, readable, and written the name of those antibiotics which we routinely give. Right. So not in the practice in India rather than in the UK or USA. So I think for the postgraduate, I get feedback from them. So most of them do say that they understand the books very well. That was my target, and that it has got everything. And I tried to give everything in the book. So when my book came, the second edition of my book had come last year, and then the COVID came, and so my publisher didn't want me to get another edition for 2 to 3 years because he had published 10 books. But I said no. I want to write the COVID chapter in the book. Fantastic. So within a year I had to come, and plus this amended MTP Act had come. So 2 topics I said I have to give them. So I want to come with a new edition. So this thing, and my book had full chapter on COVID. There was no book at that time with COVID chapter. So I had really difficult time to write it from the ACOG guideline or from various articles. But my book had COVID chapter, COVID in pregnancy chapter, even before Williams. Williams edition came after a year of my book.
Wonderful, sir.
So, same way amended MTP Act. So I update my books very regularly. They have almost everything, And I'm very open, dear students, if you read those books, I mean, if you, I don't say that you don't read Williams, you don't read Tillinde, you do read them also. You should have them also, but you should have these books also. Spending little bit money, all of you are earning good amount of money these days. Just spending 2,000 rupees on a book is hardly, I mean, you spend, even you go a weekend for a movie and dinner out, 3,000 rupees are spent. So spending money on books, and have hard books, soft books may not make that much interest in
Very
this.
true.
So you have to have balance between the two. I am sad that these days many final students even in AIIMS, they're not reading books at all. So they are doing from the courses, these NEET PG courses, that is the study they are doing it. By all means you do that, but you have to have one textbook in every subject.
Very true.
That then only you can make impression in your mind. So you have to balance between the two. So that is how, sir, I wrote the books. My target was that every medical student, even if the student is from Darbhanga, from Calicut, from Haryana, from J&K, they should understand the book. And it is written in simple language, and it should have all the latest technology in that book.
So when I remember, sir, I spoke to 3 ladies about you before talking in this interview. I spoke to Rana ma'am, and Rana ma'am said, "Sir is really fantastic. He is very, very good."
Thank you.
Right? And she said, "Sir, बस सर जो है ना, अगर एक बार बताएंगे, समझाएंगे तो मज़ा आ जाएगा बच्चों को." This is what she used. Then spoke to Aarti, and Aarti, Dr. Aarti Chitkara, she is very close to us.
Yes.
And she's been my student, and now she's practicing outside Delhi. She said, "Sir, बहुत अच्छा हो जाएगा इंडिया के स्टूडेंट्स के लिए, even abroad, when Professor J.B Sharma sir will be teaching." And when I was about to meet you day before yesterday, I spoke to Zainab, and Dr. Zainab Vora, who's been your undergraduate student, I asked her, "What should I talk to Dr. J.B Sharma sir?" And she said, "Sir एक टीचर हैं, वो अपने आप ही पढ़ा देंगे, आपको कुछ करना ही नहीं पड़ेगा." But sir, when I was a student myself, and one of the teachers who had a great impact on my life is Dr. Thamim Saif. He's from Bangalore. He spoke one line to me. He said that एक टीचर वो होता है जो मुश्किल चीज़ों को आसान बना दे. The role of a teacher is to make things simple. The second impact a teacher should have is retainable होना चाहिए जो वो पढ़ाए.
Absolutely.
And third होना चाहिए आप उसको imply कर पाए into your practice and day to day. I think your books have got all these features. It's simple, they connect, and they're step-by-step approach. And I will request the team who edits this video, beneath this video on YouTube, kindly put the link to his books. Because sir's book, student after watching this video should not struggle to any other site. The link of the book should be available here, and then they can purchase the books. So that should be hand in glove. And we will also request, sir will give us the latest images of the books, so that at the end of this video, we can show you these are the books sir has authored. So you get the right book in your hand and study. Sir, it was phenomenal talking to you. It was a wonderful, simple, connecting interview. And what I believe, sir, is that knowledge, skill, clinical science, mentorship, authorship, they all can be acquired by great patience and hard work. But there are 2 things which I see in you. They are very, very difficult, but they come naturally. One, you are a fantastic human being. Second, you have a connect. You have a connect with your students. You have a connect with your patients. And everybody in the team is so easy around you, And, एक बड़ा इंसान वो नहीं होता है जो बाकी सबको ये बताए मैं कितना बड़ा हूँ. एक बड़ा इंसान वो होता है जो अपने आसपास सबको बड़ा फील कराए. So meeting you, the way you treat all of us is an honor. Thank you very much, sir. Thank you very much.
Thank you very much. Thank you.